Oh my God, Mr. Tenzer?
Yes, hi. Can you hear me?
I'm just doing roll call.
Yes, I'm here.
Thank you. Ms. Davis?
Yeah.
Moving on to item 2, items for approval, which is the board's consent agenda. We'll bundle items 2A through 2D for approval, which includes the minutes of the March 11, 2026 meeting. Revenues of $49,604 for March 2026. Expenditures of $457.36 for March of 2026. And employee reports for March of 2026. We're going to need a motion to approve in a second.
So moved.
Second. Ms. Bostic?
Yes.
Dr. Solomon?
Yes.
Dr. Solfer?
Yes.
Mr. Tenzer?
Yes.
Ms. Davis?
Yes.
Moving on to item 2E, retail licenses. Is there anything about these licenses the board should be made aware of tonight?
No, they're all in compliance.
Board will need a motion second to approve.
Motion.
Second.
Ms. Bostic?
Yes.
Dr. Solomon? Dr. Solfer?
Yes.
Mr. Tenzer?
Yes.
Ms. Davis?
Yes.
Moving on to item number 3, board liaison reports. Are there any reports tonight from any liaisons to the council?
I went to the March 17th council meeting, but there was nothing regarding. Report.
Okay, moving on to item number 4, committee reports.
Personnel report in closed session.
Any other committee reports tonight?
I did attend the March 31st meeting, but there's nothing also. I forgot there were 2 others too.
I went to the city council yesterday. Also
Yes.
nothing to report.
How long did it last?
No, I would say an hour.
Oh, that's not bad at all.
Yeah.
It's usually 3 hours.
Oh, really? That was the first
Yeah.
one I saw. I mean, I did it online, but an hour. I know I was expecting longer.
You've done good.
All business communicable disease update, Jeff.
My turn.
You got the floor.
Last time we talked about vaccination rates and falling vaccination rates in New Jersey, including was that the immunization audit reports that are provided to the state, and that's why we see why I say that vaccination rates are gradually falling in New Jersey. And they're based off of this report, which is the immunization audit. And so this was done by Claudette Murdoch. And I like, she did a good job of putting all the schools, and you could see non-public, public, and the grades and the enrollment. And so you could track. So the first part is, so you see initial 92%. I'm going off the ability for the first one. We have an extra one for Dr. Sofa. So,
Thank you.
so it says 92%. So when they went there, Claudette found, well, somebody didn't have their vaccination. The school wasn't in compliance. So she did a re-audit and they're back 100%. So when you see 100%, just reiterating, when you see 100% compliance, that doesn't mean that everybody in there is vaccinated. It means that they're vaccinated according to the law, which is if you have medical exemptions or religious exemptions, that they have the documentation to show it. And that's the point. So the results for Englewood, they're in my report. So just reading. So for measles, mumps, rubella vaccination, there were 35 religious exemptions, 1 medical exemption, and it shows the rate. So 36 divided by 1,926 is a 98% vaccinated vaccination rate. And what worries me is down the road, 20 to 30 years from now, I'm sure there are some women in that group. And then if they get pregnant and they're exposed to rubella, with German measles, the possibility of a birth defect is there, especially in the first trimester of the pregnancy. And that's what worries me. You'll see this cohort go down and they won't even know. They won't even know that they didn't, that, oh, German measles, they're not even gonna know what that's all about. So that's what's the part that troubles me, and that's why I like to push vaccinations, these childhood vaccinations. The next part, you remember last year, we talked about pertussis, and that's this graph right here in my report. So last year, there were 40 confirmed and probable cases of pertussis in Mid-Bergen's jurisdiction. And once again, Mid-Bergen has about 250,000 people in it, so it's 1/4 the population of Bergen County. So you can imagine if there were 40 cases within Mid-Bergen's jurisdiction, then there are probably about 160 confirmed or probable cases within Bergen County. That's my assumption. So I think it's rather high, but you do see it was in 2012, you had 31 cases. So you do see these blips, these increases, and then it dipped down to 15 this year. And in my report, you'll see there were 2 that were not vaccinated, and those are in italics. So the 7-month-old and the 1 year, 10-month were not vaccinated. And then all the others were vaccinated with the Tdap or some variation of it. And 3 had an unknown vaccination status, which means the person didn't know, we didn't have any record of it, so we couldn't really prove if they were vaccinated or not. And that was the 19-year-old, the 47-year-old, and the 85-year-old. We couldn't determine if they were vaccinated or not. And that's my report for.
I have a question about the pertussis. So when, obviously in the older people, there's a booster, right, that you get. So are you saying they got the booster or they got their first, they just had a pertussis vaccine in their lifetime?
That's a good question. And I had a feeling you were gonna ask me that because I don't know. And I don't know. I would think, I would say, looking at myself, that I would have looked and seen when the last vaccination, because it says on there they were vaccinated. So, yeah,
It's not a
you don't
yes or no
know.
question.
Like when were they were vaccinated? Yeah, when they were 5 years old. Now they're
I
65.
also have a question. Are there any sort of public health measures to remind people to get the boosters? Because it should be every 10 years. And, some people do see their primary care, but for those who
Mhm.
don't,
Mhm.
I mean, maybe CVS will remind them, but I don't know if there's anything you could do or.
Right, so when I talked to the health educators, I said, look, there's an opportunity, and we did it in Closter. So they had a senior health fair, and so our table event was just talking about the pertussis booster shot, and if you're vaccinating your children. So.
It's also for tetanus, which.
Yeah,
is really.
it's good too,
Yeah.
and I think that's how most people get it, because
Right.
they get cut,
Mhm.
and then they'll go get it.
Yeah.
So, Dr. Solomon, I'm gonna look at these cases. I'm gonna go back and look and see these cases, and you'll get an email from me when I go through and see.
Pertussis is rough in older folks, right? It's pretty bad, I heard,
Yes, it's really bad for
as you
babies.
get old.
And I mean, as you get older, but for babies specifically, because they don't have full immunity. But I was wondering, do we ever have vaccine fairs?
I'm sorry, say that again?
Do we ever have like a vaccine fair? Like,
But, we haven't had a vaccine fair, but we do offer vaccines when we do have, health fairs and,
okay.
other
Within
events.
the,
Because the other thing I've noticed with this vaccine, it's really hard to keep track of when you had it. Because we don't have the best medical records in this country, other countries just go online and find it, but I don't know.
I think they're doing it.
Not Priscilla, Claudette has a system
Right,
in New
it's all
Jersey.
NJIIS.
There's a
And
New
now they're
Jersey
making
system
it
they use here.
mandatory. They're, so that everybody has to be on that system. So,
But you have to remember, I know I get everything. I don't know when, I have no clue. It was 65 years ago. I mean, I don't know.
So all primary care physicians are using this new system?
it's been around for a while.
I mean, it syncs with I think like the EMRs where you can just look up someone's immunization history.
It's so nice when it's on there. Okay, I know.
So
That's
maybe
not
that should be
first.
part of our outreach.
Yeah, cause I
Something.
just keep track of my vaccines in my phone, like that's how I know when I got vaccinated, I'm sure. A lot
Something
of
like that,
people don't
just to
know.
put it out there so that you can put it in.
Yeah.
phone or
Exactly.
Records, 10 years, you know.
Mhm.
I know I.
Hard to
I
keep track of.
don't know if I did.
Right, exactly.
Okay, so I'll write to Julie Green about these ideas. Next.
We're going to item number 6, public health events and outreach, ladies.
Oh, we skipped the bylaws. I think.
Oh, I think I forgot Mr. Wilson. Updated it.
I
I'm
didn't
sorry.
get the update.
Number 6 is bylaws. So thanks again to Josh for updating them, putting them all together. And I did send them out to everybody after the last meeting. So hope everybody got them and had a chance to read them and we can approve them tonight. What do you think? Nothing changed from what we talked about at the last meeting.
Then we just need a motion to approve the updated bylaws.
Will you?
I will.
I'll second.
Okay.
Ms. Bostic,
Yes.
Dr. Solomon,
Yes.
Dr. Solfer,
Yes.
Mr. Tenzer,
Yes.
Ms. Davis,
Yes.
So I suppose this is item number 7 then, public health events and outreach.
Yes, sir. I have a question. I'm sorry, before we move on. So who has that main copy? It would be Paula, you? Of the bylaws, just want to know.
The new updated approved.
yeah, I
Okay,
think,
I want to make sure you have the latest one. Look.
for events, we have the Spring into Wellness Challenge, starting April 19th through May 31st. This is a free annual support total wellness, physical, mental, and community health, bringing free resources directly to the residents in partnership with Englewood Parks and Rec. The fitness activities is Zumba at McKay Park, Tuesdays at 10 a.m. and Thursdays at 6:30 p.m. There's also special dates for special aerobics at McKay. It's April 21st, 23rd, and 30th. Oh, for the wellness challenge, the health educator told me so far there's 48 people registered. There's also a free fitness classes held at Dream Fitness in Englewood. There's a bonus, attend Sylvan Family Live Well Center classes to earn extra raffle tickets. There's also free health services every Thursday evening. Bergen County Department of Health Service mobile units provide free vaccination, blood pressure, and other health screenings, cancer education, and prevention resources. The community partner providing resources on site, it's Rica Water is providing free water for all participants.
Alzheimer Association.
Thank you. Bergen, Newbridge Medical Center and the Hope One Bergen County Mobile Discovery Van. Participants and benefits, they get raffle and prize, fun, supportive community environment. Then there's also a plant seed of hope.
Oh, sorry.
Oh, sorry. It encourages participants receive wildflower, sunflowers.
Zinnias.
Thank you.
Zinnias.
Encourages mindfulness and stress relief, support healthy living, food awareness, promotes growth, healing, and resilience.
Is there any other business to discuss tonight?
We wanted to talk about the environmental, if we want to talk about that in new business. Is it okay with everyone? So can you, Elisa and Jim, or all of us, what are we looking at? Just for the group?
So there was, an airborne,
Air quality.
thank you, air quality test, that took place like 2 weeks ago. About 2 weeks ago, we just got the report. And, DPW,
Right now, they're working, have a company come in to survey to see, what remediation steps need to be done to make sure that the department is in good shape.
I think the results are on page 17.
yeah,
It's
the
an
big
executive
package.
summary.
There's an executive summary, yeah, on page 3. Page 3 is the summary and the recommendation.
I looked through it. I didn't, actually, I thought it was gonna be a lot worse. 'Cause before COVID, the police department had a leak, there was a leaky roof. They had a mold growing in there. So this report was surprised it wasn't as bad as I thought. I was expecting a lot worse when, because Elisa called me today. I'm like, oh no.
Well, we're calling today, and I say, oh, no.
Okay, so look at the carbon dioxide measurements in the thing. How could increased carbon dioxide? It must have been from the fire department had a running engine out there and it blew in how do you get that? And then there was a VOCs. I think the VOC level is probably something getting back in there. So some type of.
So if you go to, I don't know what page it is, but I looked at it and had the acceptable, not acceptable. There was just one area I wanted to look at. I don't remember the page. Do you know what I mean? It was.
Yeah.
You know,
Sure.
It's near the end.
17?
I think this is lengthy, like the first section.
It's
Uh-huh.
5 of 32. I think it's like the second section where it's like, keep going, where it's 5 of 30 on the back.
Oh, in the back.
Yeah, it's like
Okay.
a second page of 32 and 5 of 32.
Oh, I see what you're saying.
So there's recommendations for remediation in the report.
Yeah.
Yeah, that's what I wanted to
We're
see
waiting
what
for-
the area-
Information.
Is it acceptable, slightly elevated, acceptable, most
Yeah, so
acceptable?
it was the spores, which kind of fungi were located, I think, that's what it
Right.
was, were the ones.
In the middle.
It's been in both, like, in
Yeah.
the past, we've had, someone come in and Pete, was it Pete?
But they're gonna treat it, they're gonna take care of it. I'm on vacation next week. I'm not.
It's big, it is big.
Moving on to public comment, require a motion to open for public comment. A second and a vote. Speakers will have 5 minutes and must state your name and address.
Should I go on public comment?
Second.
Ms. Bostic,
Yes.
Thank you.
Dr. Solomon,
Yes.
Dr. Silver,
Yes.
Mr. Tenzer,
Yes.
Ms. Davis.
Yes.
Is there anyone who would like to speak tonight? Sure. Resident.
So it's name and then address and then.
My name is Stephen Weinberg. Good evening, everybody. I am at 558 Broad Avenue. Just a couple of quick ones. I attended a STOMP seminar on the 30th and end of March. This is regarding tobacco. It is a Stop Tobacco Offenses Merchant Program Conference. I attended, Crystal Brown from the Environmental Commission also attended. There were a number of good points made. This was all about reducing the use of tobacco and vaping among the youth in New Jersey. We have that general problem also. So just to make everybody aware of some of the things that are going on, the minimum age for smoking in New Jersey is 21, not 18 like we grew up with. So that's item one. Item two is Jersey has on its books now a law that prevents the sale of flavored vaping. I just wanted to make everybody aware if they're not already. And lastly, we were hearing a variety of reports on issues that were creating positive results for the various towns. And one of them that struck me was Teaneck came out with ordinances that restricted the number of places that could sell vaping products. And that limitation actually resulted in fewer, over time, because they didn't close anything, actually reduced the number of places that were selling the products. They ran undercover operations to make sure that people were in compliance, like nobody selling to underage residents, and also not selling under the table of flavored vaping. And breaking that ordinance several times would amount to revocation of license. And it seemed to be a good model for us to perhaps suggest and adopt to our city council. So I bring it to you guys to think about that. That's item one. Item two, very quickly, is there will be on May 1st through 3rd an Abilities Expo. This is a polite way of saying that this is for people with disabilities. It is a really good exposition. It is held at the New Jersey Convention Center, which is about 35 miles south of here. And it is free for attendees. So you can acquire lots and lots of good contact information. It's about New Jersey and New York. The literature alone is worthwhile, just for general knowledge. So I leave that with you guys as well. I did leave a copy. And lastly, a question, if I could, which is, what is the status on radon testing? I know we had a program and we were giving out radon test kits. And I was just curious whether we have an update on results of like how many got distributed and how many people actually followed through with the testing, et cetera. I don't need to know any specifics. So obviously privacy laws being what they are, but I was just curious about the numbers, whether they were positive results, negative results, where we stand with radon in the community in general. That's it. Thank you very much.
As far as the radon, we'd have to get back to you next time so that,
I kind of know that because Leonia is interested in doing the same project that Julie Green is doing here. And I think Julie Green said that 19 kits were distributed, which was far below the number that we have on hand. She said there's a lot of drawbacks for people wanting the free radon kits. One is they have to pick them up here in person. There's a lot of requirements that are involved with getting a free radon kit. And then as far as the what you were stating about the tobacco enforcement is Englewood does do a program. It's called TASE, Tobacco Age of Sale Enforcement, where we have it underground, and we've been doing it here in Englewood for many years, over 10 years, where we go around and have an undercover person who's not 21 who goes and tries to buy tobacco products from the various stores that sell them. The board implemented a vaping license. I think it's $1,200 per year for.
900.
So it's up there. It's a penalty, not a penalty. It's a license, and so that's what Englewood does.
Very good. Thank you.
And then we have individuals online.
Nick?
Yeah, I think he wasn't able to unmute.
Someone chatted.
Okay, he's on. You're Nick. We could hear you now.
Hi, everyone.
Okay, sure. I'll just read some statement into the record.
And who you are, so everyone knows.
Oh, name and address.
Sure. Nick Prastos, 176 South Van Brunt Street, um, for Le Gourmet Factory. So good evening, everyone. My name is Nick Prastos. I want to start my comment by saying that the health department for Le Gourmet, or on Le Gourmet's behalf, has put real work into keeping things moving and running at our facility. Inspections, license verifications for other towns when our members work out of town events, follow-up calls, coordination. I don't take that work for granted, and I'm here tonight as a partner, not as a complainer. I'm here to talk about the kitchen unit fee structure and to ask the board for one specific adjustment. First, some context on what our members actually are. They're low-touch, low-risk operations. Most of them come into the kitchen once a month, some once every 3 months. They're making a batch of jam that they sell throughout. They're making a batch of jam that they sell through for a whole summer. They're testing a cake recipe. They're prepping for a single farmer's market or a single catering event. They're not running a restaurant. They're not handling raw poultry at scale. They're not a food processing line. These are early stage entrepreneurs with day jobs trying to turn a passion into a business. Le Gourmet Factory itself has been in Englewood since 2012. In that time, we've helped over 800 food businesses get off the ground. After the pandemic, we deliberately changed our model. We no longer cater to the larger commercial operations that used to fill our kitchen for corporate catering in the city. We now serve almost exclusively side hustle food startups, people who want to do business legally in a commercial kitchen while they figure out what their idea has, whether their idea has legs. We are at 65 members today. We're tracking to 100 by the end of this year, and our goal is 200 members over time. Every one of them is the kind of small, low-risk operator I'm describing tonight. We are not a high-margin operation. This is a passion project, not a profit center. We partner with the Englewood Neighborhood Pantry at a discounted rate. Every year at Thanksgiving, we give our kitchens for free to Turkey Time to help feed families in the city. We're a lifeline for people who cannot afford to open their own facility and want a safe space to test whether their idea can become something real. The current ordinance sets three tiers for our kitchen use: $30 for 10 days, $60 for 3 months, $150 for 6 months. That tier structure is thoughtful. It matches usage cost. It matches usage to cost. Where it breaks down is the year-round math. A member who needs the kitchen across a full 12 months pays $150 twice, $300 a year. Let me put that number in context with the board's own fee schedule. An Englewood supermarket over 50,000 square feet pays $750 a year. A full-service restaurant pays $250. A luncheonette with 200 seats pays $550. Le Gourmet Factory itself pays $1,500, which is already double what the largest supermarket in the city pays. Under the current structure, a Le Gourmet member making a few batches of hot sauce a year ends up paying a higher kitchen fee than a restaurant that operates 7 days a week. That's not proportional. That's not what a fair fee looks like. Here's the scale. Our current membership is 65, and we see roughly 15% turnover each year. Members pay for a period, sometimes go out of business before the 12-month period or 6-month period or 3-month period is up, and new members come in and pay fresh. That means the health department actually collects on closer to 75 members a year, from Le Gourmet alone. Under the structure I'm proposing, That's around $11,250 in member fees for the next 12 months, plus the $1,500 Le Gourmet itself pays to the health department. Over $12,700 a year from one shared kitchen. That's more than any single food business in Englewood contributes, and we're happy to contribute that. We want to. What we're asking is that the rate on individual members to be fair to what they actually use. So here's my ask. Keep the three-tier structure you've established exactly as written. The $30 and $60 options work and should be available to members whose usage matches them. What I'm asking the board today is to change the top tier. Make $150 cover 12 months instead of 6. $150 per member per year. That's a fair number. It's proportional to our members' actual usage. It still delivers over $12,700 a year to the health department from Le Gourmet alone, factoring in our membership churn. And it keeps the shared kitchen accessible to the early stage food businesses that depend on us. In exchange, we're continuing to take work off the department's plate, live booking calendar that we offer to Priscilla and her team, monthly member list that we deliver in the first few days of the month, bulk inspection days we've been establishing. And in addition to these things, we're also becoming in the process of becoming a disaster recovery kitchen for Bergen County. So we want to be a partner. We've really enjoyed our partnership with the Englewood Health Department. And I'm asking the board to consider this as a reasonable adjustment proposed in good faith by a business that's paid the department every year since 2012 without exception. Thank you.
Thank you. Priscilla, you wish to make a comment?
Hello, thank you so much. Hi, I'm Priscilla. I'm with the health department, just in case you don't know. Thank you, Nick, for bringing your proposal to our attention. I think that I need time to reflect on it along with the administrators, and we'll have to get back to you. But I'm glad to hear the full perspective and everyone else to hear the full perspective of what you have to offer. And we'll definitely have to take out some time to look into this. And hopefully, we'll be able to work on something amicable for us all.
Thank you, Priscilla.
Mm-hmm.
You've done an amazing job for us, by the way. We really appreciate your time. I know you've allocated a disproportionate amount of your time to Le Gourmet. We appreciate it. The members appreciate it.
I'm just working on office down there.
Happy to set up a space for you.
I'm sorry. No, I was gonna say thank you for that well thought out, well presented presentation.
Thank you for that, for the time.
There's someone from the Gourmet Factory that wishes to make a comment.
No, that's just Allison listening in. She's our office manager.
Is there any other public comment this evening? There's no further public discussion. The board will need a motion, a second to close the floor.
Thank you. Ms. Bostic,
Yes.
Dr. Sadler,
Yes.
Dr. Solomon, Dr. Soper,
Yes.
Mr. Tenzer,
Yes.
Ms. Davis.
Yes.
The Open Public Meetings Act of the State of New Jersey permits the exclusion of the public from discussions of employment matters. And it's going into closed session requires a motion and a second.
At all.
Ms. Bostic, Dr. Sadler,
Yeah. Yeah.
Dr. Solomon, Dr. Soper,
Yes.
Mr. Tenzer,
Yes.
Ms. Davis?
Yes.
And then we say goodbye to Priscilla.
Right. See you, Priscilla. See you, Nick.
Good night,
See you,
everyone.
Allison.
Good night.
Okay. Good night.
That's right.
Oh, they're going. And then I'm gonna stop recording. And then I have to stop the. Oh, I see the YouTube here.
There's another window.
Yes, because Mr. Tender's there.